At 5 health checkups that can be risky for those over 70, we'll dig into why your doctor might suggest them and what you need to consider before agreeing. Remember, knowledge is power. And when it comes to our health, it's never too late to make informed decisions. So if you're over 70 or caring for someone who is, keep watching. You might be surprised by what you learn and empowered to take charge of your health in a whole new way. Let's get started. 1. Annual physical exams. These are the routine checkups we all know well, involving blood pressure, heart rate, height and weight measurements, and a general Q&A about our health. But here's what many doctors are now saying. By the time you're in your 70s, your body has already given you decades of signals. If you haven't been paying attention, it is unlikely that a single annual exam will suddenly reveal something you didn't know wasn't right. This isn't about skipping checkups altogether. It's about focusing on what truly matters. As we age, it's more important than ever to have regular screenings for conditions that tend to affect older adults. We're talking about things like heart disease, diabetes, cognitive decline, and certain cancers. So instead of a general physical, consider asking for screenings tailored to your specific needs and health history. Remember, prevention and early detection are key, but they don't have to come in the form of a yearly physical. 2. Routine blood tests. For many years, doctors have used blood tests as a standard part of annual checkups, even for people who aren't showing any signs of illness. The thinking was that early detection of issues like high cholesterol or high blood sugar could prevent major problems down the road. However, experts now say that these routine blood tests can cause more confusion than clarity, especially for older adults. Here's the problem. Many older adults have what's known as subclinical disease, meaning they have conditions like high blood pressure or high cholesterol that don't show any symptoms. When routine blood tests pick up on these conditions, it can be really hard to know what to do next. The findings might suggest taking medication, but there's often little evidence that doing so will actually prevent major health issues or extend lifespan. In fact, taking medication can cause its own set of problems and side effects. So instead of relying on routine blood tests, it's a better idea to focus on a healthy lifestyle, including a balanced diet, regular exercise, and stress management. Of course, if you have specific concerns or a family history of certain conditions, talk to your doctor about appropriate screenings. The key is to remember that just because we can test for something doesn't mean we should. 3. Routine EKGs. An electrocardiogram, or EKG, is a test that checks your heart's electrical activity. It's often used to detect things like irregular heartbeats or signs of past heart attacks. For many years, doctors have recommended routine EKGs for all adults over a certain age, typically starting around 65. But recent research suggests that this might not be the best approach, especially for those over 70. Studies have shown that routine EKGs often miss significant issues like blockages in the arteries that supply blood to the heart. And when they do pick up potential problems, it's often unclear what to do about them. This is because many older adults have what's called atherosclerotic heart disease. This means that their arteries are narrowed due to plaque buildup, but they're not showing any signs of chest pain or other symptoms. The problem with routine EKGs is that they can give a false sense of security. If an EKG looks okay, it might reassure someone with heart disease that everything is fine when it really isn't. So unless you have specific symptoms or risk factors for heart disease, it's probably not necessary to have routine EKGs. Your time and money are better spent focusing on what you can control, like your diet and exercise habits. 4. A test for prostate cancer. The prostate-specific antigen, or PSA test, is a blood test used to detect cancer in the prostate gland. It's been widely used for many years, but recently guidelines from organizations like the American Cancer Society and the U.S. Preventive Services Task Force have become more restrictive about who should get the test. They recommend that most men over 70, especially those with no symptoms or risk factors for prostate cancer, don't get routine PSA tests. Why? Well, here's the thing. Prostate cancer is very common in older men, but most cases are slow-growing and may not cause any serious symptoms. The problem with the PSA test is that it is not very good at telling the difference between a slow-growing tumor that might never cause trouble and a more aggressive one. When a PSA test comes back with an abnormal result, it often leads to a lot of anxiety and additional testing. But this doesn't necessarily mean that a man has aggressive prostate cancer. Instead, it could be caused by something much less serious, like an enlarged prostate or prostatitis. So, if you're over 70 and don't have any symptoms or risk factors for prostate cancer, it's probably not worth going through the stress and potential harm of unnecessary biopsies or treatments. Number 5. Routine colonoscopies. A colonoscopy is a procedure used to look inside the colon and rectum. It is often used to detect polyps or areas of the colon that may be showing signs of cancer. For many years, the standard recommendation was to start getting routine colonoscopies at a certain age, with most guidelines suggesting beginning them at 50. But recent research has challenged this long-held belief. Studies have found that people over the age of 75 who don't have any signs of trouble may not benefit from routine colonoscopies. In fact, for some people, the procedure could do more harm than good. That's because colonoscopies aren't 100% safe. There's always a small risk of complications like bleeding, infection, or a perforated colon. And while these risks are generally low, they become more significant as we age. Plus, if a colonoscopy finds something that looks suspicious, it often leads to a biopsy, which carries its own set of risks. So if you're over 70 and don't have any symptoms or risk factors for colon cancer, you might want to consider the risks and benefits of routine colonoscopies carefully. Talk to your doctor about your individual situation and make a decision that's right for you. Remember, knowledge is the first step towards taking control of your health. Share this video with others over 70 and help them stay informed. Until next time, stay healthy, stay informed, and keep making great choices for your well-being.